Welcome to my new playlist that is the Oriented History Taking. This playlist is very important. A doctor and a patient relationship start with a history taking. A doctor diagnose the disease cannot diagnose the disease without history taking. Without history taking, doctor is not able to treat any kind of disease. With good history taking skills, doctor can make good diagnosis, and good diagnosis leads to the good treatment. So this playlist is very important, and in this playlist I will tell you each and everything related to the general history and the specific history of all these systems. And also we will discuss differential diagnosis, how we will differentiate different diseases, questions you need to ask in each symptoms, and the reason behind each question is very important. Ask relevant questions to the patient. So let's start our most important playlist, that is oriented history taking. First, as I told you, we start with a journal history. When patient come to you, what you will ask, it's very important. First, you need to ask the patient about his or her identity. Identity, its name, gender, age, marital status, all of these things, his nationality, his or her nationality included in the identity. Next, we have chief complaints. Patient came always came with the chief or main complaints. What are his or her complaints? This is included in the chief complaints, and the this is chief complaints are the present illness the patient comes with. Next, we have history of present illness. We ask the patient about all his history of the presenting complaint. Next, we will review all the systems, maybe any other systemic disorder leads to the present illness. We will review all the systems such as cardiovascular system, respiratory system, central nervous system, genitourinary system, GIT, gastrointestinal system, locomotor, skin, all the systems we will discuss and ask questions from them. Past medical and surgical history. If there is any patient who treat who get treatment in the past or any surgical history, we will ask from him or her. We all these discuss in detail. I will tell you the introduction first. In case of female patient, we ask for menstrual and gynecological history. If she is pregnant, if she is married, we ask for this. Family history, many diseases travel in the family, so we ask the patient about family histories such as diabetes, hypertension. These travel in the family, so we ask for family history. Most diseases comes from genetic disorder, so we ask for family history. It's very important. Next, we have social and occupational history. Occupational history is very important. The patient working environment, her environment, air particles, if he inhaled, if air is impure, then we ask for the patient social and occupational history. What occupation, what social background he has. Occupational lung disease is very common in impure air environment, so we ask for occupational history. And the last, in the general history, we will ask about the drug history. Many drugs also cause reactions to the patient, so it's very important and essential to ask for the drug history. These are the things I will tell you next in much more detail. So let's start. This is the part 1, journal history. First, I told you identity, or demographic details. This is right on the on the doctor prescriptions. We will ask for the patient about his name, his or her name. You should record the patient name, his father, grandfather name. Many patients come with the similar name so that they don't mix with the each other conditions or complications. So this is the basic thing, we ask the patient name. Next, we ask the patient about his or her age, date and place of birth. Why this is important? Certain diseases affect certain age groups, such as acute rheumatic fever. What is it? It is an abnormal immunological response to group A streptococcus infections. This is common in the children. It affects the multiple systems such as cardiac, neurological, musculoskeletal, and dermatological manifestations. So, acute rheumatic fever is common in children, while ischemic heart disease usually affect the middle age or elderly patient. What is ischemic heart disease? It is a coronary heart disease in which heart arteries become narrow that supply to the myocardium muscles of the heart. So this condition is ischemic heart disease and it is most common in the middle age or elderly person. And next is the dementia. Dementia usually affect the old patient. Dementia is a loss of cognitive functioning, thinking, reasoning and remembering ability become lost. It affect the activities of daily living. Next, third thing we ask for the gender or sex. Most diseases are sex-linked recessive inherited diseases. For example, affect some diseases affects males only, like hemophilia A and B, while female is the carrier in this case. What is the hemophilia? It is a severe hereditary hemophilic disorder in which when there is a cut on the patient's skin, the bleeding does not stop. There is a there are two types of hemophilia, hemophilia A and B. In hemophilia A, factor 8 protein deficiency occur, while in hemophilia B, factor 9 protein deficiency occur. So most diseases are gender related. Next, we ask the patient religion. Nationality is also very important. Some diseases occur in children like Schistosoma mansoni. What is this? It is a waterborne parasite of a human. It causes fever, cough, abdominal pain, diarrhea like conditions. This is common in the children. This is common in the Egypt nationality people, while the malaria is common in the Yemen. What is the malaria? It is caused by the parasite mosquito and it is a severe condition. Next, we ask for the marital status and number of children. It's also a part of journal history and it is very important. Why? Also ask for married, divorced, separated, or widow. Depression is more common in the widow because they are living alone. Most cases there is a sexually transmitted diseases to the partner, so it is very important, you can see, to ask for the marital status. Gonorrhea and hepatitis B. What is gonorrhea? It is a sexually transmitted diseases caused by bacteria, while what is hepatitis B? It is the inflammation of the liver. It's also spread from person to person, so these things are very important to ask. Next, seventh thing, we have a next of kin. Any, what is kin? Any close relative. It's very important because many diseases spread from person to person. So it is very important to ask the patient health status. Next of kin identification is important and it is critically ill patient and to receive the instruction about the patient health status. We can go for this. First we ask the name, age, date and place of birth, sex, religion, nationality, and why is it important, I told you in the detail. I hope so you clear in this. Next, eighth, we have occupation. Occupation is very important. Also ask for the previous job and the recent job the patient is doing. If the patient is retired, self-employed, we can ask. Many diseases such as the leptospirosis, it is common in the sewage workers. What is leptospirosis or brucellosis? This is the occupational related diseases. It is the bacterial infection that can spread from animals. Leptospirosis and brucellosis, these are spread from animals. So this is very important to ask the patient occupation. I told this before, occupational lung disease, it is very common in the farmers because it's come from the certain work environment. An epileptic patient who is a driver, we tell the patient not to drive because in the epilepsy seizures patient abnormal electrical activity in the brain occur and there is loss of consciousness also occur, so it's danger for the patient to drive. Next we ask for address. You might need to contact with him after his discharge or connect with his family, so you concern his progress day by day. So it is very important. And many diseases the patient may be living in an environment in which there is an endemic diseases, so many areas are famous for some diseases. Okay, so we need to consider a address of the patient. And the last thing, we have a time, date of admission and source of referral, whether referral from a private clinic or private healthcare or from other hospital, it's also you can ask. These are the 10 things in the journal history. Next I will discuss the first we study the identity, and the second thing we have a chief complaints. What are the patient chief complaints? The complaints which made the patient come to the doctor. The patient has a complaints and he come to the doctor to tell his complaints, his or her complaints. Example, frequent bowel motion for 2 days before admission. It is chief complaint. And it is very important to talk with the patient in a simple language, not use medical terms. For example, in case headache, fever, patient can understand. Coma, patient mostly not understand. You can say loss of consciousness. Shortness of breath, you can say instead of dyspnea because patient not understand the word dyspnea. Palpitation, patient mostly not understand. You can set awareness of heartbeat. Edema, I know what is edema, swelling, ankle or foot swelling, but to the patient you can set ankle or feet swelling. This is the common terms. Cough, vomiting, patient can understand. Hemoptysis, patient cannot understand. You can say coughing up blood. Cyanosis, I know what is cyanosis, bluish coloration of the body. You can tell the patient each and everything in a simple language, not use medical terms. Next, chief complaints. After chief complaints, we can we have a third thing, that is history of present illness. What is the history of present illness? A known case of diabetes mellitus, hypertension, epilepsy. Analysis of chief complaints. In this history of present illness, we can ask the patient about diabetes mellitus, any kind of primary or secondary hypertension, epilepsy, and complete analysis of chief complaints, review of the all systems, patient or his family reaction, hospital reaction, and also progression in the health status of the patient in the form of improvement, or when the patient come, now there is improvement or not, patient condition now. It's very important because the doctor has a duty to improve the patient condition. The third thing, that is the history of present illness. And the next fourth thing, we have a review of system. I told you all the systems we will review. Why it is important? Because most of the diseases from one system affect the another system. The aim is to find by direct inquiry, close questions, whether there are other symptoms where the patient has not volunteered during history taking. Maybe some complaints patient may forget to tell you, to uncover symptoms, or was uncomfortable about to disclose. You can go through the review of the system and the rule out which things patients don't tell or forget to tell. Close questions are those that answer in the yes or no. The systems we will ask is the following. First, CVS cardiovascular system. We can ask in the chest pain if the patient feel any kind of pain. It include in the cardiovascular system dyspnea, shortness of breath, claudication, any neurological or vascular symptoms when the patient start walking, orthonia when there is a sudden drop in the blood pressure, peripheral nerve disorder, palpitation, any kind of awareness of heartbeats, syncope, dizziness, fatigue, or ankle swelling or edema. It's these questions included in the cardiovascular system. We can ask these things in the cardiovascular system review. Next we have respiratory system. We can also cardiorespiratory system are questions are interrelated. Chest pain, dyspnea, we can ask for the cough, sputum, types of sputum, hemolysis, coughing up of blood, wheezing sounds, and the stridor, any kind of abnormal sounds. These questions included in the respiratory system. Next, GIT, gastrointestinal system, anorexia, loss of appetite or increased appetite, abdominal pain, altered bowel movements, diarrhea, patient have a frequent bowel movement or constipation, flatulence, nausea and vomiting, weight loss, hematemesis, vomiting up of blood, any kind of jaundice in which bilirubin level is increased, dysphagia, any kind of difficulty in the swelling, melena, stools become black color, bleeding per rectum. These questions asked in the GIT. Next, the gast, genitourinary system. We can ask dysuria, any painful urination, frequency, nectaria on the night time. Go for urine urgency, urine retention capacity, polyuria, hematuria, any kind of blood in the urine, incontinence when you cannot control urine, loin pain, urine or bowel movements, an intermittent stream, post maturation dripping. These are all the complications that come in the gastrogenitourinary system. These are the systemic review: cardiovascular system, respiratory system, GIT and GUT. Next we have three systems. Central nervous system. In the central nervous system we ask for the headache, dizziness, vertigo, visual disturbance. Vertigo means syncope, dizziness when there is loss of consciousness, syncope, loss of consciousness. These are all the related terms. Limb, weakness, convulsions, tremors, any kind of abnormal movement, paresthesia, and myalgia. Tremors, paresthesia, and myalgia, muscle pain. These questions asked in the central nervous system. And next, the locomotor system. In this, we will ask the questions like joint pain, any kind of swelling in the joints, joint stiffness, joint locking, muscle weakness, muscle fatigue, any kind of deformity. These joint and muscle related questions asked in the locomotor system. While in the skin, we have a fatigue, ecchymosis, itching, and the skin rashes, skin infection, any kind of skin related things we can ask in the skin. Next, we have a past medical and surgical history. This is very important. If patient has any medical history and any kind of surgical history in the past, we will ask, because the any kind of surgical or medical history that patient suffer come in the future also. Previous same symptoms or similar attacks, previous hospitalization, why his go to the hospitalization, when his go, previous any kind of operation, there is any complication in the operation, this can ask. Any kind of blood transfusion, because there are many diseases like that spread with the blood, so we can ask for any kind of blood transfusion. Previous investigations and the screening test performed with patient, tuberculin test for the TB, mammogram is for the breast cancer, stool for occult blood. If there is any hidden blood in the stools, this is the test for this, we can ask from him or her. Previous vaccination, the patient can go through. Childhood illness, if patient have any kind of measles in the childhood, whooping cough, mumps, rickets is the bone disease, and rheumatic fever, infectious disease, if the patient has faced in the childhood, we can ask. Any kind of chronic illness like diabetes mellitus, in which there is a problem with the insulin, hypertension, primary or secondary hypertension, ischemic heart disease, chronic kidney or renal disease, any kind of asthma, that is the respiratory tract infection, epilepsy, seizures attack, hepatitis, TB, or sudden cardiac arrest, in which patient heartbeat suddenly stop. These kind of illness included in the past medical and surgical history, we will ask. The following relevant question in the past history need to be asked initially in response to the patient's symptoms of presenting illness. These past medical and surgical history is very important to ask. This you can ask from the patient. Next, if the patient has presenting symptoms like ischemic chest pain, you can ask the angina pain, myocardial infarction, hypertension, diabetes mellitus, and hyperlipidemia, high cholesterol level. If the patient has infective endocarditis, you can ask from skin infection, any kind of penetrating trauma, or dental work, recent dental work. If the patient has dyspnea, shortness of breath, you can ask these questions. Similar attack when you feel any kind of hypertension, diabetes, myocardial infarction, in which there is a blood supply become less to the myocardium, heart muscles that help in the contraction. You can ask the fever, asthma, tuberculosis, deep venous thrombosis, any kind of pelvic injury, pelvic surgery. These are the questions you can ask in case of shortness of breath or dyspnea. When the patient has palpitation, you can ask the similar attacks, any kind of angina pectoris, myocardial infarction, you can ask. If the patient has a cough and Jordan's, you can ask. In case of cough, you can ask bronchiectasis, in which there is a respiratory damage to the bronchis. Whooping cough, you can ask in the cough history. If the patient has Jordan's, in which there is bilirubin level is increased, you can ask from him the hepatitis, because these are interrelated. Any kind of abdominal surgery, blood transfusion, you can ask the following question in case of Jordan's. If there is a melena, when there is a black colored stool, you can ask the hepatitis. Jordan's, in this case, gastric ulcer, cirrhosis. What is cirrhosis? It is this scarring or fibrosis of a liver, in which there is a end stage liver. Liver is damaged totally. Abdominal distension, in case of abdominal distension, you can ask Jordan's, hepatitis, hypertension, COPD, cardiomyopathy, previous abdominal surgery, intestinal obstruction, respiratory diseases. All these you can ask in the abdominal distension. Next, we have menstrual and gynecological history. In case of female, this is very important. You can ask the age of menarche. Is there is a normal precocious puberty, means before age, primary amenorrhea, in which there is a primary causes when the menstrual cycle not start. In case of birth control pills females used, this can cause secondary amenorrhea when there is more than 3 months and the menstruation not become regular. You can ask the length of the menstruation 20 to 40 days, its normal period up to 3 to 7 days, and amount you can ask. Dysmenorrhea, any kind of pain. Menorrhagia, when there is a prolonged menstrual bleeding. Intermenstrual bleeding. Intercourse. Dysmenorrhea, this is superficial or deep postcoital bleeding. These are the things you can ask from her. Menopause age. Postmenopausal bleeding 1 year after the last period. Any kind of abortion, when it is a surgical procedure, when the patient when there is end of pregnancy, patient cannot become pregnant again. And the miscarriage, in which before 20th week the pregnancy end. These are the questions you can ask from her. Family history, I told you, it's very important. Marital status, you can ask married, divorced, separated, or widow. Partner, his name, age, occupation, children number, age, and their health status. Father name, age, and occupation. Mother also, and brother and sisters there, if any kind of illness or disease in them. Same symptoms in the family, because to rule out any kind of family history that comes from one generation to another. History of any kind of surgery in the family. History of death in the family, their cause and date. Disease affect more than one members of the family. Most of the diseases, genetic diseases, that travel in the family. So family history is very important. And some example of single gene inherited disorders. There is a autosomal dominant, autosomal recessive, or X-linked. Autosomal dominants are adult polycystic disease, when there is cyst form in the kidney. Huntington disease, this is a learning or developmental disability. Myotonic dystrophy and neurofibromatosis, this is also a genetic disorder. NF1 gene disorder. Next, we have autosomal recessive diseases, in which include cystic fibrosis, when there is respiratory and gastrointestinal tract problem. Sickle cell anemia, when there is red blood cells become sickle like. Alpha thalassemia, when there is a disorder with a protein like alpha globin. Alpha 1 antitrypsin deficiency, this is also a genetic disorder. X-linked disorders like Duchenne muscular dystrophy, in which there is a muscular weakness. Hemophilia A, when there is no blood clot formation. Fragile X syndrome, these are all the disorders with the genes, inherited disorders. Social and occupational history, ask the patient, because the patient or any person spend most of his time in doing his work in the work environment. Housing, own or rented house. Water and electrical supply. Number of rooms. Sanitary or health or cleanness of the condition, is there is a polluted air or not. Smoking, patient is doing active when it is doing smoking himself or herself, or it sit with the smokers. Passive smoking, alcohol drinking, any kind of pet he has in the house. Hobbies, any kind of traveling history, this is very important. Traveling history, you can ask any kind of stress patient is facing. Contact with the patient with the same symptoms. These are the social and occupational history. Many diseases can spread from person to person, and the environment the patient is living also matters a lot. Calculating pack year, if patient is smoking, you can ask the cigarette or smoking history, you can ask the number of smokes or cigarettes he used per day. And the last we have a drug history. In the drug history, you can ask for the chronic use of a drug like steroids, contraceptives, warfarin, heparin. This is the blood thinning agents, aspirin for any kind of fever or pain condition. When there is chronic use of drugs, this can also lead to the illness. Allergy to any, some patients are allergic to drugs, so you can ask this. Any kind of drug side reactions, over the counter medications. Many patients use drugs on their own, so over the counter medication, herbal preparations patient use, you can ask these type of things, because many drugs have side effects. Radiotherapy in case of cancer, psychotherapy, all these things are very important. And in case of drugs, name of the drug patient use, dosage, duration, how many he use, how frequently he use, route of administration. There are many routes: oral routes, rectal route. You can ask who responsible for the administration of the drug. Patient use mostly drugs on their own, you can ask any kind of side effects. Storage of the drug, is the disease will controlled by this drug. Any kind of drug history, patient use any expired drug. If you use overdosage, these can cause drug reactions. And this is the complete history, general history taking. I think I will cover most of it. If you have any question, you can ask. I will tell you each and everything in detail. I hope so you like this video. Thank you.